Medication is intended to be a good thing. However, the interaction of some medications can be dangerous. Here to explain what we need to know and what we should look out for is Dr. Mark Thiele with Badgers Medical Group. Mark, thanks for being here.
Thanks for having me, Jeff.
Well, this is common and it's something that people need to know about and they may not think about all the time. But why is it really so important to understand that drug interaction can really be dangerous?
Well, you have to take into consideration, for example, certain medications, the way they interact, they can either cancel each other out or they can increase the levels of a certain medication that may have some problems that might be life-threatening, perhaps.
So is it typically a medicine, like you say, canceling one out, or is it maybe taking it, if they're taking it at the right times, or there needs to be a certain time span? You know, is it chemical reactions, is it timing? Explain kind of, I'm sure there's probably both. Huh?
It's a combination of everything you just mentioned. A good example of that is Coumadin, which is a blood thinner, which is used for, let's say, a patient who's had a DVT or a pulmonary embolism. In a geriatric population, which they're very sensitive to medications to begin with, just an over-the-counter cold preparation that may have, let's say, ibuprofen or an arthritis medication can actually increase the levels of that medication into a dangerous level, which could result in a spontaneous bleed, for example.
So how do people really understand that? I mean, you know, you're taking your normal medication, you get a cold or, you know, the flu, and you go to the pharmacy like we all do, and, you know, how do people know that they need to watch this?
Honestly, a lot of people don't. And it really comes down to the physician and the pharmacist working together to educate our patients as far as possible interactions, what to take, what not to take, and overall good patient education is the key.
Well, I know, you know, when we all go to the doctor periodically, they ask you to update things and what medication you're taking, and, you know, nobody really wants to sit there and fill out the form, but I guess then it really is important to do that, huh?
It really is, Jeff. One habit that I've made a really good habit of is I have a little pocket computer that I bring into the exam room, and if they're a patient, let's say a geriatric patient, they're on medications for arthritis, for blood pressure, for diabetes, what I'll do is I might punch in the actual medications and see if there's an interaction, and then I can educate my patient, or I can have the nurse do it as well.
Now, what about medicine that they may be taking, maybe they're going to a specialist and it wasn't really prescribed by you? Is that just part of this conversation and filling out those forms properly?
Exactly, Jeff. And the main thing is, as a primary care provider, I look at myself as the center of the wheel. Because you might have a cardiologist on board, a psychiatrist on board, a nephrologist, and it's really up to that primary care physician to keep that medication list updated, because we want to prevent a drug-drug interaction.
What are some other common examples?
Well, a great example, besides the Coumadin and, let's say, a Motrin or Advil, is nowadays, let's say with the elderly, with the arthritis, it's a very painful and difficult problem to deal with. And Motrin, let's say, or Mobic, just doesn't work. And there's a medication recently that was taken off the market, which is Darvon, which seemed to work well in the geriatric population. However, a medication that's being given out or prescribed is Ultram, also called Tramadol. In combination with a patient who's on, let's say, an antidepressant, for example, Paxil, Prozac, it may lead to something called serotonin syndrome. What that means, Jeff, is you get flushing of the face and your blood pressure shoots sky high, and that can be dangerous.
Well, say, for example, somebody's been taking a medication and kind of like that one, something's taken off the market, or maybe, you know, the consensus is made, well, let's change to another one and see if it improves or whatever, and people start to not feel right. What kind of signs would somebody look for at home if they thought, well, maybe this is a drug interaction issue?
Well, let's say the two examples I've given so far, let's say with the Coumadin, basically any bleeding around the gums, any increased kind of bruising. Also with the combination of the, let's say, the Ultram and antidepressants, specifically the groups called the SSRIs, is their blood pressure spiking.
Okay. And you mentioned there's another example that you wanted to bring out?
Well, there's several, Jeff, but the main two is the Coumadin and the and the Ultram with antidepressant.
Well, you mentioned both the doctor and the pharmacist. What are their roles, and what should someone be talking with the pharmacist about?
Well, the pharmacist and the physician should really have a good working relationship. I try to keep everything where my practice is within house. This way, if there's a problem, actually, they can call me on my cell phone and say, you know, Dr. Thiele, Mark, what do you think of this? And then this way I can make an adjustment in the medications or kind of tweak the dosages so there's not as much of a chance as a detrimental effect.
Okay, because a lot of times it may be the patient who notices, or the pharmacist, or even the family member. But you know, there's a lot of information on the packaging.
Yes.
Yes. All possible side effects. Some even sound like they conflict each other.
That's right.
So where's there the information overload, and should people still read that, but count on that, make sure they have that conversation with their doctor?
Absolutely, Jeff. It's important because when you really look at the system, starting at the level of the nurse, the doctor, the pharmacist, and just the label on the pill bottle itself, you really have like 4 different filters there for the patients to really be aware of possible complications. And ultimately, it helps the patient out, which is the most important.
What are some common questions you get from patients who may think that medicine is making them not feel quite like they used to, in a negative way?
Well, the main thing is, you know, am I going to feel fatigued? And are you talking about the side effects, Jeff?
Right.
Yeah,
right.
mostly fatigue, and you know, am I going to have flu-like symptoms? That kind of deal. Jeff, one thing I wanted to mention, another example, and this is really important, is Viagra, the blue little pill. Mm-hmm. That in combination with, let's say, the nitro products for chest pain, those cannot be taken together because that can really cause an effect as far as really low blood pressure, and a patient can bottom out.
Okay.
Yeah.
One last question for you.
Yeah.
Can some of these interactions also result in confusion or something that might be misdiagnosed, you know, by a family member or whatever, as maybe dementia setting in or something like that?
Absolutely, and we would take that into consideration because especially in the geriatric population, the last thing we want to do is put a patient at risk for a fall.
Mm-hmm. Okay. That's great information, Mark. Thank you very much. It's common
you.
sense, but we all need to make sure that we're on the same page and
Thank
know
you.
about that. Thank you very much.